Hey everybody, it's Dr. Reiser. If you like what you see in our videos, make sure you click subscribe so that you don't miss out on any future videos about functional medicine, nutrition, and tips on how to reclaim your health the easy way with Functional Health Center of the Carolinas.
Hey everybody, it's Dr. Reiser. Welcome to another Whiteboard Wednesday, and this week's Awareness Week is for blood pressure. And we know many people that have blood pressure issues. Probably every single patient that comes through my door, maybe 9 out of 10 patients, have blood pressure problems or that are prescribed a blood pressure medication. And there's gonna be a big difference. So the first thing I'm gonna touch on before I get into anything else is what true hypertension is. If you're running 160 over 100 for your systolic over your diastolic blood pressure, that is true hypertension. The problem these days is we're not using natural agents to help lower our blood pressure, and we're reaching right for these prescription medications. I'm going to talk about 3 things that you can take to lower your blood pressure, but first let's touch on the overprescribing of these medications. If your blood pressure is 140 over 90, you have high blood pressure, but you're not hypertensive. And that's a problem because that's the average you'll see people get on blood pressure medications, okay? The issue is the side effects. Blood pressure medications cause dizziness, they cause stomach upset, muscle pains, fatigue, overall fatigue, erectile dysfunction in men. I see it all the time. So if we can help this naturally, that is preferred, obviously. The paleo diet seems to be the best way to do this. You're basically eating whole foods, vegetables, fruits, lean meats, fatty fish. That helps, but there's 3 things that if you don't want to overhaul your diet completely that we can implement, and that's going to be starting with something called potassium. So potassium has been shown time and time again to be one nutrient that if you increase it in your diet, it starts to lower your blood pressure regardless of who you are, and actually especially if you're somebody that has hypertension. So number 1, we want to add potassium-rich foods in your diet. So potassium, your daily value that you should get as a minimum is going to be 4,700 milligrams. And the average American really only gets about 2,000 milligrams a day in the standard American diet. If you're paleo, you usually get about 10,000 milligrams, so you're way over what you should be, but that's, the more you can get, the better. 600 milligrams of potassium, just 600 milligrams will lower your systolic blood pressure by 1 point and your diastolic by 0.5. So systolic by 1, diastolic by 0.5, just from 600 milligrams. And if we're reaching 4,700 per day as a minimum, you can start to lower your blood pressure significantly. So foods for this, bananas is a big one. We all know bananas have high potassium. Avocados have just as much potassium as bananas. Spinach would be one thing, sweet potatoes. So as you can see how the paleo diet really encompasses those foods and you eat those pretty consistently. So that's number 1. Number 2, people love this one, dark chocolate. All right, but not just any dark chocolate. Dark choc, 80% and above. When it's made 80% and above cocoa, you have antioxidants in there, you have flavonoids in there that actually help the endothelium of your blood vessels. And it helps you have excess, or not excess, but more nitric oxide in your body, which expands your blood vessels. When your blood vessels expand, that's a lot more room for blood to go through, and that lowers your blood pressure. So don't go overboard or crazy with this, but a couple squares at night after dinner will help lower your blood pressure. Third, last but not least, we're going to talk about a tea. Okay, sounds weird, but we're going to talk about specifically hibiscus tea. So hibiscus tea, you've seen it at every single grocery store, whether it's Publix, Harris Teeter, Kroger, Giant Eagle, wherever you are in the United States, you will find some hibiscus tea. Studies have shown that 2 to 3 cups a day of hibiscus tea in research studies, an individual that drank 2 to 3 cups a day lowered their blood pressure, especially if they were a hypertensive and diabetic. So just imagine what it would do for somebody that's just a hypertensive or somebody that has normal blood pressure. Now you're also probably wondering, will this lower it too much if I add these in? No, if you have normal blood pressure and you add these in, this will not lower your blood pressure too much. You would want to avoid things like blood thinners that could possibly do that. But these will make sure you normalize your blood pressure. So if you're someone that struggles with hypertension, you don't want to take medications, obviously I'm not advocating for that to pull off your medications, talk to your doctor about that. But start implementing these a little bit so that the next time you get a blood test or the next time you get obviously the cuff test at your doctor's office, you can maybe get off some medication. This is a natural, easy way. If you want to get it and hit it really hard, the paleo diet is going to be the best way to do that because it implements a lot of these in there. Other things as far as blood pressure that we can always talk about, one of the biggest ones I see, insulin resistance. You don't have to be a diabetic to have insulin problems and blood sugar problems. So lowering carbohydrate load, increasing your protein has been shown time and time again to lower blood pressure. It's as simple as that. Up the amount of protein you're eating, lower the amount of carbohydrates, and you will start to normalize your blood pressure. So hopefully you guys can pick these up at the grocery store. I know I am about to leave the office. I'm going to grab some of this stuff just to keep my blood pressure down and keep the stress down. So if you have any questions about blood pressure, if you have any questions about any more things that you can take to help lower your blood pressure, email us, DM us, or give us a call, and look out for another Whiteboard Wednesday next week.